It's the morning of Zach Murphy's open heart surgery.
Morning, everybody.
Morning.
Are you all sorted for this morning as best you can?
As best I can, absolutely.
Big day for Zach, a big day for his mum and for the team here as well. But we have every hope and confidence in Zach. This is a day you know he needs, but it's also the day that terrifies you and you want to run away from it. So we'll hopefully get going in the next half an hour as well.
Okay. Thank you. Oh, well, I'm prepared for it now, Tara.
We have to fix the big blood vessel coming out of his heart, the aorta, that's interrupted and has no continuity with the aorta going to his body, so we have to try to join those two together. To do what we're doing here is novel, that's for sure. And hopefully, if all goes well, we'll get quite a definitive repair. Clearly, if things don't work in our favour, or anatomy is unusual, or there are any unexpected elements, then that might alter our plan. We're thinking only of the anatomy in front of us and how to fix it. And we don't, our emotions don't play part of that, if you want.
It takes an hour and a half to open Zach's chest, connect the cannula or tubes and put him on the bypass machine, which will completely take over the function of his heart and lungs while Professor Redmond and the team operate. With Zach safely on the heart-lung machine, the team can now begin to tackle Zach's complex repair. Donor tissue called a homograph from an adult donor is needed to create a patch for the interruption in Zach's aortic arch. It's stored at minus 178 degrees Celsius in liquid nitrogen.
How cool are we now? So we're 20.7. We're going to be ready to give cardio and low flow shortly, okay? Not quite there yet. How long are we cooling in total?
At this stage, the team start to cool Zach's body, dropping his temperature to 18 degrees so they can safely stop the blood flow for a limited time and protect his brain.
When we hit 25, we'll probably cross-clamp, okay?
They need to keep things moving during this pressurized part of the procedure.
We could just have, instead of just a standard patch, we could do an elongated patch that covers both. Start, okay. We need to do a BT shunt. I don't think I have any choice. It won't work on this side. All right, I'm going to snuggle down on everything first.
Zach has been in surgery for over 4 hours. They've had to stop his heart completely and push him into circulatory arrest. There is no blood flowing to either his body or brain. He is in this protected state for 14 minutes. And the team are against the clock to carry out the most challenging part of his surgery as quickly as possible to keep him safe.
I could do you want to see if we could get a 6 through there, or is 5 enough? Probably 5 is enough. Even use the back wall of the stent, but patch it there, so we could attach that on there. And then patch it up onto the trickle.
Rewarming his body, the heart is beating again, but only with the support of the heart-lung machine. Coming off life support is the most crucial part of the operation and will reveal if the repair has been adequate.
Aoife, hi, it's Helene here. Yeah, would you meet me up on the parents' room, up on the Children's Heart Centre? Is that okay? Professor Redmond has done a BT shunt, not bidirectional limb. But he said the pulmonary arteries are small. He hasn't had a big discussion with me. He felt like he's still operating on Zach. Now, at the moment, the saturations are a bit on the lower side. Okay, so when I say lower, they're down in the 50s and 60s, and we need to get those saturations up.
Zach is struggling to cope with the new blood flow. Only one part of the operation was possible, and if he survives, he will have to have a second stage in a matter of weeks. Zach's oxygen levels are now running dangerously low, and the team have to decide how to respond. They have to put him on ECMO, a life support machine which will continue to bypass his heart and keep him alive until he can recover. ECMO is giving him a lifeline, but there's no guarantee he will manage to come off the machine.
Mark, will I let Mum know?
Yeah.
Zach is going on ECMO.
Oh, okay.
So I've been back downstairs again. As I said to you, the saturations have been low. The lung arteries are on that smaller side, and we're trying to encourage blood flow out to them. It's not something we're shocked about. We'd love not to have to use it, but we have it there as a backup, as a support for Zach as well over the course of the next 24, 48, 72 hours. And it could be a bit longer than that, Aoife. Or maybe
Are they leaving his chest open?
Yeah, they will be leaving his chest open. Zach had come off the heart-lung machine, okay, and was off the heart-lung machine, but I think the feeling is if we leave him off, he'll run into difficulty. Where if we support him, Aoife, he will do it. That's our hope. That has to be our belief system. But we know it's a big step. This is like climbing Everest for Zach today and for Professor Edmund, but also for you. You're there with him as well, and the family. But we just have to try and stay, and I'm not going to say stay strong. It's how do you stay strong at a time like this? But he has to go through this to get to the other side. Just like when you were having him, it's one thing being pregnant, it's another thing delivering him, and knowing that he had this heart condition, that you had to get to that other side with him, and you've got there. Now we need to get him to the next side of this.
Thank you.
Okay. All right. So I'm going to leave you with your mum and dad, and I will be back to you. Okay. Okay.
Will you be able to see him in ICU, or will it hurt you too much?
Well, it was a long day, and as big an operation as we expected. There were certainly findings that were not quite what we would have anticipated from the preoperative studies, and that made life a little bit more difficult to get everything repaired, but in the end we were able to get a satisfactory repair in all aspects. But clearly we have to play it minute by minute, hour by hour. We watch everything very carefully. We take nothing for granted. The fact that we're on ECMO means that there are some issues and risks associated with that, and you might say that there is a concern that we will have difficulty coming off ECMO, and that is true. We just have to wait and see how things go.
We have many more children with Down syndrome in Ireland than maybe in other jurisdictions within the European zone or within the US. Children with Down syndrome have many needs that other children don't have, but our job is to advocate for the child and the family and to maximise that child's potential. That's what we tell parents when we meet them is we will help deal with your child's heart defect and give you every chance to make your child as well as possible, to live as full and happy a life as possible. Our job is to advocate for the child and the family and to try to give them the best care that we can, but also if there are bumps in the road where maybe there's a delay or a deferral of surgery, it's important that we remain optimistic.
There, Mum. If you lie her up here, pop the blanket off. Right here.
Clara Cleary has been an inpatient waiting for surgery for over 2 weeks. It has been scheduled for tomorrow, but her pre-operative x-ray reveals she has a bacterial infection in her lungs.
Now, all done. Perfect. Now, I'll move this section away.
Great. So you see the consolidation there? There's probably consolidation atelectasis. It's a little bit patchy here as well. No, I think Mark and the radiologist is right that we need to treat this before we just go into surgery, Yeah. The white cell count isn't terribly high, and the CRP isn't terribly high, which is reassuring. But the radiologist was just a little bit concerned there's a bit of infection there.
Okay.
So the one thing we want to do is make sure she's really in optimal condition going into the surgery. Particularly with the bypass machine, they don't want any risk of infection there. Yeah, so I know that's a bit of a disappointment. But it's just a bump in the road, we'll get over it and get on with things. Alright, good. Okay, hang in there, stay patient, you're very good. We'll get there eventually, okay?
Thank you.
Thank you.
Okay. Thanks.
When it's a bad day, your heart really goes out for families because you realise that the upset and the trauma that they go through with that. And it's enough to deal with a child who's got a serious heart problem, without having to worry about whether or not surgery is going to be delayed or cancelled. There's no doubt that the disappointment for them and the sort of trauma of going through that is it's not small, it's a pretty sizable problem for them.
Clara is being kept in the heart centre and has started on a course of antibiotics. Her parents can't return to their home in Donegal and remain with her on the ward. Zach Murphy has been on ECMO life support for 2 days, but is showing some signs of improvement. His heart is doing half the work for itself.
Hi Mark, it's Orla. I'm just ringing to give you an update on Zach. Will you give me a ring when you get him home? Thanks a million. Pumping function of Zach's heart is excellent, and the shunt coming down is working well, going into those branch pulmonary arteries. So I think for the moment we're in a good place. I think the next question will be how we can wean, and when we start turning down the settings on the ECMO, whether or not that will be okay and whether he'll be able to cope.
Yeah.
And I think as opposed to a lot of kids who are on ECMO who are very kind of bloated and purple with poor cardiac output, that's not the case here. He looks good. He looks great. Okay, so he's looking good. I'm going to go to the Coombe and do my clinic.
Okie dokie.
Find another Zach.
Have fun. Oh, you probably will. Hopefully not.
Okay, I'll see you later.
Take care, Dr. Franklin. Thank you.
Oh, is the 50 euro bottle? I think so, or a total, yeah.
It's the morning of Lee Kosh's surgery to switch his ventricles and arteries. The double switch is a rarely performed procedure, which, although risky, could offer Lee a fuller life expectancy.
When it comes to clearly a very unusual operation or one that we only perform a few times a year, clearly I'll give that, perhaps if you want, a little more thought in planning it, making sure we have all that we need to do the operation, but in particular that we have not just a plan A but a plan B and C, because in complex situations and complex physiology we are inevitably surprised by what we find. And so we have to be ready for several pathways of outcome, and so in that respect we prepare significantly for those kind of cases.
You're going in here to see your mummy and your daddy.
The challenge will be that Mark will go in and he will identify potentially subtleties about the anatomy, and I suppose the question is, will we be able to pull it off? Mark is a superb surgeon and Lee is in very, very good hands, but even in his hands this operation will represent a challenge.
Since Lee's ventricles are reversed, the surgical team will attempt to switch them to redirect blood flow from one side of the heart to the other. The heart's major arteries must also be switched, which will correct Lee's circulation so that the left side serves the body and the right side serves the lungs. But Lee's heart has other abnormalities too, which further complicates things.
Okay, we're ready to do the switch, right? The only thing the problem is this is quite small. It's going to be hard to do the VSD through that. Single ventricle is the only way we can go. And if that's the case, then if we're doing a Glen, do we do a septectomy now?
Professor Redmond has discovered that Lee's unique heart will not support a double switch. He has to find another option.
Orla, just two quick questions, just to confirm my thinking is okay. One that when we looked in, I looked through every outflow tract. There's no doubt. I'm comfortable saying it's not septatable. So that's number one. Number two. The question is, if we do a Glen, which is fine, we lose a little bit of access, don't we, from an EP standpoint? But that's the only thing. Does that matter too much? No. I'm comfortable with the decision. Okay. Thanks, Orla. You betcha. Bye. Bye. Well, we're going to have to change plan. We're going to have to do a Glen rather than the full repair.
The Glen operation is part of a series of surgeries which will still buy Lee many years of life.
When you find yourself in that situation, I suppose the question you have to ask is, are you willing to risk everything for your shot at the perfect solution? And the perfect solution here for sure was a double switch. The problem was that there was a very significant chance that Lee would not survive that. And so we had to look at the balance of risks, and we had to say, well, should we do an operation that will get Lee Cotter 30 or 40 years for sure? Or we do something that's incredibly high risk that may get him to 70, but probably has a greater chance that he won't get to tomorrow. And so therefore, on that basis, we made the decision to go for the Glen. So it wasn't what the Cotters were expecting. But I think for Lee, ultimately, it will be the outcome that offers him the best chance at as long a life as we can get for Lee.
You're literally putting your child's life in someone else's hands and you've no control over it. And you just have to trust them and you have to be hopeful always and be confident that they will give him back to you. So they did, and look at him now already.
We wouldn't have even thought he'd have opened his eyes today, like, to be honest. But,
he's really back to himself already, isn't he?
Yeah, he's a fighter, like.
You're so good. I cut it. Oh, you're good. We'll get you some apple juice then, yeah?
Yeah.
Want some apple juice? You like your apple juice?
I have cold.
You what? You want Coke? Is that what I heard you say?
No.
Clara Cleary has been waiting for surgery for nearly 3 weeks.
We're pretty convinced, although she had that viral infection recently, but it's not one that worries us too much for the heart-lung machine, as much as the other viruses do. So we're happy enough to proceed. She's been afebrile, so the time is right for her. So it's just now a matter of getting the bed that we need in the ICU.
Clara Cleary in bed 6 is her 4-month-old, and she's trisomy 21 with complete AVSD and secundum ASD. But she is fasting now for theatre this morning. She's first on the list and she is ready to go.
There'll be about an hour to an hour and a half of preparation. So that time will be about 10:30 when Professor Redmond is starting.
Okay.
So I'll usually give you a buzz at around 10, 10:30 to let you know how things are going and keep you updated throughout.
There are 2 children listed for surgery this morning, but with only 1 intensive care recovery bed, the team have to make a tough decision about which child needs the surgery more urgently.
The fact is the unit is at 120% occupancy because we're over beds already again, so we have at a very big push 1 bed. So has there been a decision on which...
Well, we were just talking whether it's Clara or George, isn't that right, Orla? One of the two. Who's less sick that might go through quicker, or who's more sick needing it done earlier. It's the usual scenario. You find yourself making a difficult decision. Clara's nearly 5 months old with Down syndrome with AVSD. She's been in hospital for 2.5, nearly 3 weeks now. She's finally been afebrile for 72 hours. Her CRP white cell count is perfect. She's as good as we're going to get her.
George also needs a surgery. He's ready. He's been in this hospital since the 3rd of November. He's had no recent infections. His bloods are good. He's ready to go.
Just going back to Clara, we have a window to do her to get a good result. If we're stuck by not being able to accommodate her during that window, whether we're going to get into trouble later on.
I suppose then she needs to be the one that's done, and then if George, he gets done over the weekend or whenever he gets done.
One of you guys can go and tell him that he's cancelled. I've had enough. Like, it's just, I have got this child as far as I can, Lars. I know, he is not well.
Let's toss a coin, because that's where we're at, guys. I mean, we can all advocate. I mean, I've done 2 surgeries on George, and I would really, really like to do them. I mean, there's no doubt about that. But it's kind of...
Talking to the ID team, they don't feel that she needs to wait that long. They feel she's well enough.
Yeah, but the ID team are not operating on it.
Yeah, no, I understand that. With all due respect, I totally understand that. I'm just saying she's got a window now to do her. She'll probably pick up RSV or some other virus if we leave her another week or 2 because of her degree of heart failure. So we need to make a decision that if we're going to delay her, that we're going to continue to put her at risk. Kathy, I totally see this from George's standpoint as well, that he's just as entitled to have his operation, and the fact that we have to make these decisions is really unfair on the children, Okay. So what's the plan?
Clara's operation has been stood down, and the team break the news to her parents.
Imagine that it's your child awaiting a major heart surgery, and then you've been told it's not going to happen. So that's a real, loss for the parents. So, there's a great saying, the years are short, but the days are long. And, if it's a day where things are not going right for you, can be a really, really long day for the parents.
Zach Murphy has been on ECMO life support for 48 hours. Today the team will try to take him off the machine to see if his heart can cope without the support.
We're going to start now in about 10 minutes.
Yeah.
And it'll take us about half an hour to get all of that done. We'll still leave the breastbone open.
Oh yeah, look, take it step by step. We'll worry about that when you need to close them.
So I'd say we'll talk to you again in about an hour from now. Okay?
Yeah, thank you.
So fingers crossed. All right.
Thanks very much, Professor Redmond.
The longer you remain reliant on this machine, the higher the threat to life, and 40% of children never manage to bridge off ECMO.
Okay. Off the ECMO. And bridge.
Oxygen levels are stabilising, and Zach's own heart is now pumping blood for itself.
We look pretty good. Happy with the way everything has gone. So we just need to keep a very close eye on things tonight. We always have an option to go back on ECMO, but at the moment we look stable. We've a long way to go, of course, but at the moment I'm happy.
Thank you.
Okay?
Mm-hmm.
All righty.
Thank you so much.
Okay.
Can I give you a hug?
Yeah.
Thank you so much.
You're very welcome.
Thank you.
Okay? All right.
Thank you. Yay!
After a cancellation yesterday, Clara Cleary's time for surgery has finally arrived. She will be operated on by Mr. Lars Nolke.
There was lots of discussions yesterday in terms of which child is to be done, which child is the highest risk. It's not about picking which child needs to be done, it's about trying to prioritise the child who's at highest risk. It's not that one family is more or less important, it's all about trying to pick the child who needs it most acutely and who's going to be compromised the most if the surgery is delayed.
Okay, protamine sulfate, please.
During surgery, Mr. Nolke and the team will close the hole in Clara's heart and correct her valve abnormality. Success rate for correcting AVSD is 99% in Crumlin, and today Clara is no different.
The echo is very good. The TOE that Dr. McMahon has done is very good. She's off the bypass machine. She is currently behaving. We're closing her as we speak, and we'll hopefully be bringing her back to the intensive care in the next 20 minutes, half an hour.
Happy days. Thank God.
God.
It's great, thanks so much.
Oh, well done. You've had a tough few weeks.
I know. It was all worth it.
You're welcome. You're welcome. But it's done now. There's no more waiting.
I know. Thank God.
I suppose the backbone of our process, our service, is the multidisciplinary team. We are a department. We are not a group of doctors who work in isolation. You'll have seen on Thursday at conference, it's not just the doctors who speak.